Myopia in children might be grabbing all the headlines, but adults are also in the disease's crosshairs. Myopia can have a drastic effect on an adult's vision and quality of life too. So what to do? In a recent Cake magazine supplement, a consensus group of 11 world-renowned experts came together to frame the discussion on the current myopia correction landscape, including phakic IOLs. The consensus on selecting the most appropriate candidates for phakic IOL procedures was strong. 90% plus agreed that the degree of myopia, age, anterior chamber depth, and corneal health were the most important factors. Additionally, the stability of the candidate's refractive history was deemed critical.
We used to have only two options, either laser or lens. So the lens was obviously introduced to ourselves for the high myopes. So high myopes were not able to correct their vision with the laser because they don't have enough cornea thickness or any other anatomy to be corrected. So the foremost and most important factor for deciding whether to go with the laser or with the phakic IOL, especially ICL, was the degree of myopia. Nowadays, I don't believe that that's the only thing that we do see. One of the strong preference is the patient's preference. So even though they are having low degree of myopia or a moderate degree of myopia, they are more aware of the phakic IOL being reversible and giving them more high quality of the vision. So they like to have their eyes done with the phakic IOL instead of laser vision correction.
So I have a lot of myopic patients, and first and foremost, if they're myopes, I just check their anterior chamber depth, if it's enough for 2.8 or over, and their endothelial cell count. If those two, they pass, then they're a candidate for ICL, and then I check if they're a candidate for laser surgery. So if they're above -5 diopters, then I tell the patient, the odds swing in your favor that ICL is safer because we don't need to remove too much tissue. Your visual outcome in terms of quality of vision is better, and your predictability or accuracy is better. It used to be that only non-candidates for LASIK or PRK end up in ICL. But then as word got out, we have more and more patients, word spread. So even if I don't say ICL, I say they're qualified for LASIK, somebody will say, what about ICL? So I realized that I have to explain to everybody that there is this best option and the others are there as well.
我觉得选择手术最重要的标准就是它的安全性和有效性啊。当一个病人他经过全面的检查和评估以后，我们看他是适合哪一类手术。那么如果两种手术它都适合的话呢，我会尊重病人的意愿。但是对我个人来讲，我更愿意向一些度数特别高的或者有一些干眼的患者来推荐 ICL 手术，因为我觉得它可能对他更有利，而且对未来也会更好。
Small decisions about refractive power can have an outsized impact on final results. When asked to prioritize the 6 most common methods of determining phakic IOL power, there was unanimous agreement that manifest refraction is the most important parameter, followed by true ACD, K1, and K2.
So number one, if we're talking about the happiness of the patient, it is the manifest refraction that's most important because that goes to their visual outcome. In terms of safety, that's where the doctor and the measurements come in. So we have to ensure that they have enough anterior chamber depth and enough endothelial cell count, and they're good to go. But those things, they don't monitor. We monitor that for them.
The foremost important factor for deciding the result of the phakic IOL, especially ICL, is the manifest refraction. You can see some of very low changes and bias from the K value or chamber depth or the lens thickness and so on, but those bias are very minimal.
主角的验光的度数是决定这个经济计算最重要的一个参数。那么其次才是前房的深度啊、角膜的曲率啊，以及我们的近眼距等等这些参数。因为 验光的度数最终决定了你要计算的最后的一个度数。
This video is just one part of our series looking at the guidelines on building proficiency in phakic IOL procedures. Scan the QR code below to access the entire supplement and learn about common practices from some of the world's best phakic IOL surgeons.